Hi guys, welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anyone new, and I am back. Thank you to everyone for all the support. I just needed to take a little break, but I'm back on it. So lately we have been covering topics around career development, but I wouldn't be the Asthma Lady without going to my bread and butter, which is asthma and asthma education, awareness, and management. So today we're going to talk about health literacy and how it relates to asthma education, and how if we don't address certain things, it could be a barrier. All right. So according to the CDC, we all, in some shape or form, need health literacy. So we need to be able to find, understand, and use health information in regards to our own health, right? And so even those that can read well and who are comfortable with numbers still may have issues with health literacy because they may not be used to or comfortable with medical jargon, right? So just big words with a lot of statistics and whatever. And so this might be a barrier when it comes to just utilizing needed information. So it's always best to give people access to quality asthma education, asthma management resources that they can have access to, that they can retain, okay, so that they can understand and actually use it. And so, so I just quickly wanted to talk about some things that are in right now. So for example, things like QR codes, very in right now. So you go to the restaurant and you don't even get a menu anymore. Most likely it's a QR code. So yeah, we've gotten used to it. This and this is what it is. So when it comes to health literacy and like asthma education, what I want you to think about is your target population. So what I have seen is there are certain asthma management or chronic disease management programs where your enrollment will be through a QR code. So let's say like a disease like COPD, chronic obstructive pulmonary disease, which is mainly more mature patients. So you're going to get patients that are possibly in the 60s, 70s and whatnot. If the intervention is catered for them and the enrollment process is a QR code, we have to think about things like that, because that can be challenging for someone in that age bracket to go through the coordinated effort of going through a QR code. And so we want to think about stuff like that when it comes to dealing with certain populations, target different ages, cultures. Think about how relevant and how appropriate is it for that age bracket or that culture. You want to make sure that you're using visual aids when it comes to more mature populations. So what I do is I use models. I don't know if you can see this, right? So like colorful or something that they can touch, right? Make it engaging. Or when it comes to children, you can even make like your own DIY airway models, right? So I created this and I have a video, I'll probably TikTok video on how I make this. Real simple, easy, engaging. Kids can be involved in their own asthma education and management. They can make something like this and then you could teach them the difference of an a normal airway by using a toilet paper roll. You see this right here, and an asthmatic airway. And then you can have discussions around that. Like, why would it be difficult for somebody to breathe that has asthma, and just comparing the difference, right? See? So just something like that, just using a mixed bag of educational resources versus just using something like a QR code, or once again, if you're dealing with a mature population, you want to think about making it as simple as possible. Be careful with things where it takes a lot of coordination, like, they have to open an attachment, or anything like that, where they have to struggle, because we really don't know if they have access to a family member or someone younger that can help them with those things. So just think about that. You always want to be very aware of the target population of your asthma education intervention. All right. Because once again, this is about access. We want them to be able to find it. Okay. And when it comes to health literacy, we really want them to be able to use the information and feel comfortable with it. So think about using resources such as community health workers. Think about things like representation. It matters when it comes to dealing with culture and health literacy. And, in regards to asthma education, we want to make sure that they are able to retain the information, get it, because asthma is a heterogeneous disease. All right. So there go a medical jargon word, right? But just meaning that it is a complicated disease to understand. And so we like to use resources such as community health workers, which are peers that represent the community that we are trying to serve, and using them to break down the information for them, and just being aware of the cultural needs, right? So yes, community health workers. And what else did I forget? Oh yes, you want to be able to also make sure that you're using pamphlets of all different languages, and even using certified translators, especially for those where English is a second language. If they feel more comfortable using the primary language, then this would really help in regards to health literacy. So making sure that they can once again use the information. So yeah, today's episode, super short. But just making sure that you are aware of these things whenever you want to start or implement a new asthma education intervention or anything like that, and just finding different ways to engage those that you want to enroll into your intervention. All right, guys. So yes, I am back. And there is so much to come. I hope you learned something from me here today. Don't forget that the book, Asthma Control Please, 9 Steps to Community Engagement and Asthma Awareness, is still available on Amazon Kindle Unlimited. And I just want to say, guys, that there is so much more to come. The year is coming to an end very fast. Happy holidays. We have more guest co-hosts lined up, and we are growing together. So excited for what's to come in 2024. Keeping secrets, okay? So yes, remember, guys, that we are here every Wednesday on most podcast platforms, and on YouTube on Thursdays. All right, guys. So, and just wanted to say to remember to invest in yourself and to only compete with yesterday's version of you. See you next week. Bye.